solar, batteries, heat pumps. The way we power our hospitals is probably the last thing we think about when we visit, but MFT are making considerable progress in the decarbonisation of hospitals. And where else to kick off the decarbonisation efforts than the grounds of the very first NHS hospital? Into the NHS's early beginnings, I've come to Trafford General Hospital, which on the 5th of July 1948 officially opened as the first NHS hospital. As the birthplace of this much-loved British institution, Trafford is now looking ahead to the future to explore how it can usher in a new age of sustainability and continue to shape the NHS.
And in 1929, the Local Government Act got rid of the poor law unions and ownership of the hospital passed to the County Council. 1939, it was then taken over by the War Department for use by the Armed Forces, first by British troops and then by the 10th United States Station Hospital. Treated service personnel from loads of nations.
It was in July 1948 when an Ira in Bevan arrived to inaugurate the National Health Service. The then Health Minister symbolically received the keys from Lancashire County Council, and nurses formed a guard of honour as he entered the hospital to officially create the NHS over 75 years ago.
So what has changed at Trafford over the years, from the early days before the NHS right up to present day? What's changed?
I think the net zero commitments of the NHS show how much it needs to be a sustainable organisation for the future to be able to respond to the changing needs of a differing healthcare environment and a different healthcare population. And the only way to do that is to have sustainable buildings, sustainable operations and sustainable ways of working to ensure we've got the future of the NHS tied up for future generations.
Having proudly established the healthcare service all those years ago, today Trafford is a member of the Manchester University Foundation Trust and is keen to transition the NHS into a greener era as net zero targets loom. Also a member of MFT and just 20 minutes down the road from Trafford, Wythenshawe Hospital is focusing heavily on the task to become more sustainable.
Wythenshawe, we started a while ago, so the first big ticket item, if you like, was to de-steam the site. So we took out the old steam boilers, replaced them with LTHW equivalents and the LTHW heat distribution system around the site. That's not a modern, novel technology, but it got us on the way. That was a precursor to us adding more low carbon technologies on the front end of systems. In the meantime, we looked through power electrical capacity. We did a site-wide LED conversion, removing all our fluorescent tubes and moving to much more energy efficient LEDs. Since then, we've also done air source heat pumps and ground source heat pumps in a number of areas, integrating them with the existing heating system to further reduce the gas.
Intrigued to find out more, Callum Donnelly showed me how they work.
So we're in the Northwest Heart Centre here now. Externally, we have an air source heat pump, so a bit like one of these boxes here, but located outside. The air source heat pump takes heat from the ambient air outside, and it can work down to -10, really cold temperatures. It's fantastic. It boosts the ambient air up to about 50, 60 degrees, but beyond 60 degrees, air source heat pumps aren't the most efficient. So the system that we have here is a two-stage process. So we have the air source heat pump system outside, which sends heat into this tank here, which is about 40 degrees. Once it's in this tank, it then goes through the water source heat pump here, which, as you can see on the display now, it's heating the water up to about 69 degrees. So the air source heat pump has done the first stage and boosted it up to 40 degrees. Then it goes through the second stage here and gets boosted up to 70, 75. And at that temperature, it stores in this tank, and that's hot enough then to go around the building for the heating and the hot water, even in the middle of winter.
We managed to work through some of those challenges, how to integrate air source heat pumps with our existing heating systems, what lighting systems work well in certain areas, and what BMS settings to take elsewhere also. As we've taken what we've learned on those schemes and bringing it to the Trafford scheme also, which is predicated on de-steaming the site, putting an air source heat pump, water source heat pump system. So a lot of similarities from our previous experiences.